1. Which of the following is the primary role of an AEMT during a pre-hospital emergency? A. Prescribe medications. B. Provide advanced life support interventions under protocol. C. Perform surgical procedures. D. Diagnose chronic illnesses. 2. When administering IV fluids to a patient in shock, what is the AMT's main consideration? A. The patient's favorite type of fluid. B. The rate, type of fluid, and patient's vital signs. C. Only the color of the IV solution. D. The convenience of the administration site. 3. In the context of adult learning principles, how should an E approach mentoring a new EMT? A. Provide lectures without practical demonstration. B. Encourage hands-on practice, feedback, and reflection. C. Allow them to observe only. D. Avoid interaction to encourage independence. 4. Which medication is typically administered by AMTs for severe anaphylaxis? A. Epinephrine. B. Acetaminophen. C. Buprenorphine. D. Aspirin. 5. How does an EMT ensure regulatory compliance when documenting patient care? A. Use informal notes without signatures. B. Follow established protocols, include accurate timestamps, and obtain signatures when required. C. Leave documentation for the physician. D. Document verbally only. 6. Which assessment finding indicates possible internal bleeding in a trauma patient? A. Warm, dry skin. B. Hypotension, tachycardia, and pallor. C. Stable blood pressure. D. Normal heart rate. 7. What is the most effective method for evaluating the competency of a trainee AEMT? A. Multiple choice test only. B. Direct observation of skills with feedback and scenario-based assessments. C. Verbal questioning without practice. D. Waiting until they work independently. 8. In managing a patient with suspected cardiac arrest, what is the AEMT's immediate action? A. Administer pain medication. B. Initiate high-quality CPR and attach an AED. C. Transport immediately without intervention. D. Apply a cervical collar. 9. When encountering a patient with respiratory distress, which intervention is within the AEMT's scope? A. Performing a tracheostomy. B. Administering nebulized bronchodilators and providing supplemental oxygen. C. Prescribing antibiotics. D. Inserting a chest tube. 10. How should an AMT communicate effectively with a conscious, anxious patient? A. Use medical jargon to impress the patient. B. Speak calmly, explain procedures clearly, and provide reassurance. C. Avoid eye contact. D. Leave the patient alone to reduce interference. 11. What is the purpose of a rapid trauma assessment? A. To document insurance information. B. To quickly identify life-threatening injuries and prioritize interventions. C. To complete a research study. D. To determine the patient's social history. 12. Which of the following demonstrates adherence to ethical principles in pre-hospital care? A. Refusing treatment based on personal beliefs. B. Providing care impartially and respecting patient autonomy. C. Prioritizing patients based on personal preference. D. Ignoring informed consent. 13. During a multi-casualty incident, what is the AEMT's priority? A. Attend to the most vocal patients first. B. Perform triage to identify and treat patients based on severity and survivability. C. Document every patient before treatment. D. Wait for additional units before acting. 14. How does an AMT support continuous learning in the team? A. Avoiding discussion about mistakes. B. Facilitating debriefings, reviewing protocols, and encouraging ongoing education. C. Focusing only on personal skills. D. Delegating learning responsibilities entirely to trainees. 15. What is the correct procedure for administering activated charcoal to a poisoning patient? A. Give a full bottle without checking contraindications. B. Verify patient's airway, level of consciousness, and absence of contraindications. C. Only administer after hospital arrival. D. Mix with alcohol for better absorption. 16. How should an AEMT handle conflicts with other healthcare providers at the scene? A. Ignore their instructions. B. Communicate respectfully, clarify roles, and follow established protocols. C. Assert authority over all decisions. D. Leave the scene immediately. 17. In evaluating a patient's neurological status, which tool is commonly used by AEMTs? A. Glasgow Coma Scale. B. Agar score. C. BMI chart. D. Hemoglobin level. 18. Which scenario requires immediate airway intervention by an AEMT? A. Mild nasal congestion. B. Severe airway obstruction with stridor. C. Minor laceration. D. Slight bruising on the arm. 19. What is the best method to assess circulation during patient assessment? A. Asking the patient how they feel. B. Checking pulse, skin color, temperature, and capillary refill. C. Counting the number of breaths. D. Observing clothing only. 20. How can an EMT incorporate evaluation methods into training new staff? A. Only provide written manuals. B. Use skills checklists, scenario simulations, and constructive feedback. C. Assign reading without practical application. D. Rely on self-assessment exclusively. 21. Which of the following represents a regulatory requirement for medication administration by an AEMT? A. Only document if convenient. B. Follow scope of practice, approved protocols, and proper documentation. C. Administer any medication requested by family. D. Skip verification to save time. 22. How should an EMT approach a patient experiencing chest pain with hypotension? A. Position upright and limit oxygen. B. Provide supplemental oxygen, monitor vitals, prepare for advanced interventions. C. Ignore until ambulance arrival. D. Give oral fluids immediately. 23. Which communication strategy improves handoff between AMTs and hospital staff? A. Vague verbal report. B. Use SBAR, situation, background, assessment, recommendation, and concise documentation. C. Only email information. D. Wait for hospital staff to ask questions. 24. What is the main goal of adult learning principles in AEMT training? A. Complete training faster. B. Facilitate retention, understanding, and application of knowledge in practical situations. C. Reduce hands-on practice. D. Emphasize memorization over reasoning. 25. When mentoring a colleague, what is the most effective feedback approach? A. Provide general comments without examples. B. Give timely, specific, and constructive feedback with actionable steps. C. Criticize mistakes publicly. D. Avoid feedback to prevent conflict. 26. How should an AEMT handle a patient with a suspected spinal injury? A. Move the patient quickly to improve comfort. B. Maintain spinal immobilization and limit movement while assessing ABCs. C. Focus solely on airway and ignore spinal precautions. D. Allow patient to sit upright if they request. 27. Which skill is essential for evaluating and managing pediatric emergencies? A. Adult communication only. B. Understanding age-specific vital signs, dosing, and airway management. C. Ignoring developmental differences. D. Using adult equipment exclusively. 28. How can an AEMT demonstrate leadership during an emergency scene? A. By issuing commands without listening. B. By coordinating team actions, maintaining situational awareness, and ensuring safety. C. Focusing on personal tasks only. D. Delegating responsibility without guidance. 29. When encountering a patient with hypoglycemia, what is the AEMT's first action if the patient is conscious? A. Administer insulin. B. Provide oral glucose and monitor response. C. Begin CPR immediately. D. Call family before treatment. 30. How should an EMT address gaps in team knowledge during debriefings? A. Ignore them to avoid embarrassment. B. Use case review, discussion, and targeted education to improve performance. C. Only focus on errors. D. Avoid involving trainees. 31. Which action reflects adherence to infection control protocols? A. Wearing gloves, performing hand hygiene, and properly disposing of contaminated materials. B. Ignoring protective equipment. C. Relying on patient hygiene only. D. Skipping disinfection to save time. 32. How should an EMT approach mentoring new staff in medication administration? A. Allow trial and error without guidance. B. Demonstrate proper technique, explain rationale, and supervise until competent. C. Only provide written instructions. D. Avoid supervision to encourage independence. 33. What is the most important factor when deciding whether to transport a patient versus initiating on-scene interventions? A. Proximity to the hospital only. B. Patient stability, severity of condition, and potential for deterioration. C. Personal preference. D. Weather conditions. 34. An AEMT encounters a patient with suspected stroke who arrived within the onset window. What is the priority action? A. Administer aspirin immediately without further assessment. B. Perform a rapid neurological assessment, monitor vitals, and expedite transport to a stroke center. C. Begin CPR immediately. D. Wait for family consent before any intervention. 35. During a high-stress multi-patient incident, how should an AEMT mentor a junior colleague to maintain performance and learning? A. Ignore their presence to avoid distraction. B. Assign them tasks beyond their training for rapid learning. C. Provide guidance, model calm decision-making, and give constructive feedback after each task. D. Allow them to observe silently without interaction.